Hello everyone, I'm Dr. Tanisha Bhatnagar and welcome to this academic video session from Dr. B.R. Ambedkar Open University. And today we will be looking at the topic of cardiovascular and respiratory systems. Now before starting, if you ask me why studying these systems is important for HHCM students, let me tell you, overviewing of these systems will help you in understanding the hospital setup better and for coordinating better with the nursing and the doctors. So now let's start our class. So today we will be having an overview of the cardiovascular system. We will be studying about the components of the cardiovascular system, the anatomy of the heart and the blood vessels, some of the common conditions associated with the cardiovascular system. And moving on, next we will be studying about the respiratory system, the overview, components of the respiratory system, anatomy of the respiratory system, physiology, and some of the common conditions associated with the respiratory system. Now let's start with the cardiovascular system. The cardiovascular system, which literally means heart and vessels in the language Latin, is a system in the body which essentially is related to the transport of blood. It delivers oxygen, nutrients and hormones to every cell of the body. The heart functions as a muscular pump which helps in maintaining systemic and pulmonary circulation. The blood vessels form an extensive network facilitating the exchange of various products across the body. The cardiovascular system helps in maintaining the homeostasis by removing metabolic waste and regulating fluid balance. As you can see in this video, it depicts how the heart pumps the blood. Now coming to the components of the cardiovascular system. It majorly consists of the heart, the blood vessels and the blood itself. The heart is a muscular organ which pumps blood throughout the body. The blood vessels form a closed network of tubular structures which help in transporting the blood across the body. Then the blood itself, it is a specialized tissue, a connective tissue which is composed of plasma and formed elements which help in transportation of substances such as gases, that is the oxygen and the carbon dioxide, nutrients and hormones across the body. It also helps in eliminating waste products from the body. The blood vessels are majorly of three different types. The arteries that are thick walled and they have elastic walls. They assist in transporting the blood away from the heart under high pressure. The veins, they have thinner walls and they consist of valves which ensure one direction movement of the blood and they assist in returning the blood back to the heart. The capillaries are microscopic vessels which allow exchange of gases, nutrients and metabolic wastes at the tissue level. The structure of each vessel is different and specialized to its particular function. The two atria are separated by the interatrial septum and the two ventricles are separated by the interventricular septum. The heart is located in the middle of the mediastinal cavity, slightly left to the midline. The heart is almost the size of your fist. It is a small organ but very important for your body. The right side of the heart pumps deoxygenated blood to the lungs for oxygenation, while the left side of your heart pumps oxygenated blood to the entire body. The coronary arteries supply blood to the heart muscle and provide it with oxygen and nutrients. The heart wall has three layers, starting with the innermost layer which is the endocardium, the middle layer which is the myocardium and the outermost layer which is the pericardium. The interventricular and interatrial septum prevent the mixing of the oxygenated and the deoxygenated blood. Now starting with the heart valves. The heart consists of four valves, namely tricuspid, pulmonary, mitral and aortic. These valves ensure unidirectional blood flow between the heart and the lungs, and the heart and the major blood vessels. The semilunar valves, which are the pulmonary and the aortic valves, regulate blood flow between the ventricles and the pulmonary artery, and also the ventricles and the aorta. The valves are supported by papillary muscles and chordae tendineae that prevent backflow during the ventricular contraction. The tricuspid valve is present between the right atrium and the right ventricle. The mitral valve is present between the left atrium and the left ventricle. And as you can see, the aortic valve here is present between the left ventricle and the aorta. The pulmonary valve here is present between the right atrium and the pulmonary arteries. Now moving on to the electrical conduction system of the heart. The heart has its own intrinsic electric system that controls the heartbeat with a specialized network of nodes and fibers. The sinoatrial node in the right atrium acts as a natural pacemaker, initiating the impulses. Then the impulses from the sinoatrial node move to the atrioventricular node, which delays the impulses to allow the atrial contraction before the ventricular contraction. The bundle of His transmits the impulses from the atrioventricular node into the interventricular septum. The right and the left bundle branches carry these impulses down the ventricular septum towards the apex of the heart. Now coming to the cardiac output. Cardiac output is the volume of blood pumped by the heart per minute. The formula is cardiac output is equals to heart rate into stroke volume. Stroke volume is the blood pumped per beat. Stroke volume is equal to end diastolic volume minus the end systolic volume. In a healthy adult at rest, the cardiac output is approximately 4 to 8 liters per minute. Cardiac output depends on heart rate, stroke volume, preload, afterload, and contractibility of the heart. The cardiac output ensures adequate blood flow to the tissues, supplying oxygen and nutrition according to the body demands. Now, if you think about it, when you run, your heart starts to beat faster. Can you understand why that is? It is because to meet the demands of your muscle, the heart starts pumping faster to increase the cardiac output. Cardiac output is regulated by the autonomic nervous system. During exercises, cardiac output increases up to 4 to 7 times the resting value to meet the higher oxygen demands of the muscle. Now coming to the cardiac cycle. The cardiac cycle is a sequence of events that occur in the heart from the beginning of one heartbeat to the next heartbeat, including contraction, which is known as the systole, and the relaxation, that is known as the diastole, of the atria and the ventricles. It consists of atrial systole, ventricular systole, and complete diastole. During the cardiac cycle, the blood flows from atria, then travels into the ventricles, and then into the major arteries, that is aorta and pulmonary artery, regulated by the heart valves. The lub-dub sound corresponds to the closure of atrioventricular valves and semilunar valves during the cardiac cycle. The AV valve closure leads to the lub sound, while the semilunar valve closure leads to the dub sound. At normal heart rate, that is 75 beats per minute, the cardiac cycle lasts about 0.8 seconds, with diastole being longer than the systole. Now moving on to the heart sounds. The heart sounds S1 and S2 are produced during the closure of heart valves during the cardiac cycle. S1 or the lub sound is produced due to the closure of mitral and tricuspid valves, which are the atrioventricular valves, and they mark the beginning of the ventricular systole. The S2 or the dub sound is produced by the closure of aortic and pulmonary valves, also known as the semilunar valves, marking the beginning of ventricular diastole. S3 may be heard in volume overload states such as heart failure. or can normally be present in children and young adults. S4 occurs due to atrial contraction against a stiff ventricle, often associated with hypertension and reduced ventricular contraction or compliance. The deoxygenated blood from the body tissues enters into the heart via the superior and inferior vena cava into the right atrium. The right atrium then pushes this blood into the right ventricle through the tricuspid valve. Then when the right ventricle contracts, this blood is pumped into the pulmonary arteries passing the pulmonary valve, which then gets carried to the lungs to get oxygenated. The oxygenated blood from the lungs returns back to the heart via the pulmonary veins into the left atrium. It then flows into the left ventricle passing the mitral valve. The left ventricle then contracts and moves this oxygen-rich blood into the aorta, which then moves to the entire body for systemic circulation. So this is how the pulmonary and the systemic circulation coordinate to provide the body with oxygen-rich blood. Blood pressure is the force exerted by circulating blood on the walls of the blood vessels, mainly arteries. This is why arteries are thick-walled and elastic. It is expressed as systolic by diastolic. Example 120 by 80 millimeters of mercury, which is a normal, healthy blood pressure for an adult. Systolic blood pressure represents pressure during ventricular contraction, while diastolic blood pressure reflects pressure during ventricular relaxation. Blood pressure is regulated by cardiac output, peripheral resistance, blood volume, and the autonomic nervous system. Baroreceptors in the carotid artery and the aortic arch help maintaining blood pressure homeostasis through reflex adjustments. Some of the common conditions of the cardiovascular system are coronary heart disease. This is caused when the heart's blood vessels, which supply the myocardium with oxygen-rich blood, become narrowed or blocked and cannot supply enough blood to the heart. It can lead to angina or heart attack. Angina. It is the pain or discomfort in the chest, arm, and neck because of restricted blood supply to the heart. Heart attack. It happens when the blood supply to part of the heart muscle becomes completely blocked, leading to death of that part of the heart muscle. Heart failure. It is because of the failure of the heart to work efficiently that results in body's demands for blood and oxygen not being met, and the patient develops symptoms such as shortness of breath. And fluid starts building up in different parts of the body, such as the lungs. Arrhythmia. The heart beats abnormally because the electrical signals within the heart are interrupted or disturbed. Hypertension. It is chronic or persistent high blood pressure. Now, moving on to the next system for the day, that is the respiratory system. The respiratory system is responsible for breathing and exchange of gases, majorly the oxygen and the carbon dioxide. The oxygen needs to be transported to the tissues, while the carbon dioxide needs to be removed from the body. The primary organs involved are lungs, which perform gas exchange between the air and the bloodstream. The respiratory system works closely with the cardiovascular system to deliver oxygen-rich blood to the body cells. The airway passage helps filter, warm, and transport air to the lungs. This system maintains acid-base balance and supports functions like speech and smell. The respiratory system is divided into the upper respiratory tract and the lower respiratory tract. The upper respiratory tract includes the nose, nasal cavity, pharynx, larynx, and they are responsible for filtering, warming, and humidifying the air. The lower respiratory tract includes the trachea, the bronchi, and the bronchioles, which eventually lead to the alveoli present in the lungs, also known as the air sacs. There are two functional parts of the respiratory system, the conduction zone and the respiratory zone. The conduction zone is from the nose to the terminal bronchioles. It is responsible for conducting, filtering, warming and humidifying the air, but it does not exchange the gases. While the respiratory zone is the zone which includes the respiratory bronchioles, alveolar ducts and the alveoli. They are responsible for the exchange of carbon dioxide and oxygen with the blood. Structures like cilia, mucus, alveoli and breathing muscles help protect the airways and ensure efficient ventilation and gas exchange. Now coming to the respiratory epithelium. Respiratory epithelium is mostly a pseudostratified ciliated columnar epithelium with goblet cells. Cilia and mucus trap and remove dust, microbes and foreign particles from the airways. It lines major conducting airways including the nasal cavity, trachea and bronchi. They also help in filtering, humidifying and protecting the lower respiratory tract. Now moving on to the inspiratory reserve volume, which is the extra air that can be forcibly inhaled after a normal inspiration, that is approximately 3000 ml. Then comes the expiratory reserve volume or the ERV, which is extra air that can be forcefully exhaled post a normal expiration, which is approximately 1200 ml. Then comes the residual volume, which is the air remaining in the lungs after maximum exhalation. This prevents the lungs from collapsing. It is approximately 1200 ml. Then comes the functional residual capacity, that is the FRC, which is the air remaining in the lungs after normal exhalation. That is the expiratory reserve volume plus the residual volume, which is approximately 2400 ml. Now moving to the mechanism of respiration, starting with inspiration. Inspiration is when the diaphragm, which is a dome-shaped muscle which assists in respiration, moves down and the external intercostal muscles which are present between the ribs elevate the ribs. So the thoracic cavity or the thoracic volume increases, which creates a negative pressure leading to the air entering the lungs or moving in. Then comes expiration, in which the diaphragm relaxes or moves back to its original place. The external intercostal muscles relax, leading to the ribs coming back to their original place. This creates a positive pressure in the chest cavity and pushes the air out. Now, forced expiration uses internal intercostal muscles and abdominal muscles. So, it is an active process, while normal expiration is a passive process. Some of the common conditions of the respiratory system are asthma, which is wheezing and breathlessness caused by narrowing of the airways, bronchitis, that is inflammation of the lungs' larger airways, emphysema, which is the disease of the alveoli or air sacs of the lungs, hay fever, which is an allergic reaction to pollen, dust and other irritants. Influenza, it is an infection caused by the viruses. Laryngitis, it is the inflammation of the voice box, that is the larynx. Pneumonia, it is an infection of the lungs that leads to inflammation and it can cause fluid buildup in the lungs. So as you can understand now, the heart and the lungs work together in a perfect coordination, forming a cardiorespiratory system. The deoxygenated blood goes to the lungs where it gets oxygenated in the alveoli, and then the oxygenated blood gets pumped back to the heart where the heart pumps it to the rest of the body for oxygenation at the tissue level. So now concluding this session, we can see that the cardiovascular system transports oxygen, nutrients and waste products through the body and helps in maintaining circulation, while the respiratory system supplies oxygen and removes carbon dioxide to support cellular energy production. Together, both these systems maintain life by ensuring proper gas exchange, pH balance, and overall body functions. So now if you ask me why these systems are important for HHCM students. Understanding both these systems is important for HHCM students to maintain better coordination with the healthcare staff, to understand the needs of the patient, and to maintain better infection control practices at the hospital. Now, can you tell me one lifestyle habit which affects both these systems together? Yes, it's smoking, because it damages the lungs and it also narrows the arteries. Now, I'd like to share some health tips to keep your heart and lungs healthy, which is exercising regularly, eating balanced food, avoiding smoking, managing your stress better, and practicing deep breathing exercises. Now, to conclude this session, let me end this with a simple thought. A healthy heart and a calm breath can lead to a better life. Thank you for listening. This is Dr. Tanisha Bhatnagar.